My name is Irina. I've been doing carnivore since May 2020, essentially when COVID started.
Okay.
I have a list of conditions. I don't know if you read, but definitely improved. Well, before doing carnivore, I had so many different conditions, but in reality, I tried all sorts of diets just to try and figure out if it was nutritional, and I just didn't want to take these medications, whatever they were. They gave me a lot of different medications or things I had to do, and I pretty much have been doing all sorts of things, particularly with IBS was one of them, 4 years since my early 20s or something like that. But, and I tried, you'd name it, vegetarian, at some point, pescatarian. I went to no meat, and then I went into some combine what some might call balance, which is legumes, veggie and veggie and meat combined, kind of what's called balanced. And I did that for good 4 or 5 years, just predominantly just little meat, but also a lot of the other stuff that everyone just kept telling me, take more fiber, this and that. Mm-hmm. I had different conditions that were chronic and recurring. Candida was one of them particularly, but then it was IBS, pretty heavy duty IBS. I even had vitamin D deficiency. I had bleeding gums. I had vasculitis. I had inflammation of joints. I had, exercise-induced asthma, you name it. And I couldn't even exercise because of all the joint to asthma, that was coming up. There's so many different things that were chronic that nothing was really resolving it. I got a little bit tired of doctors telling me, well, this is how it is. Some people are just affected with these things. You just have to take this and that, and then for the rest of your life. I just didn't want to accept that. And I was I'm in my mid-20s at the time, where at that point, that's when I started looking into nutritional. But my early 30s, that's when I discovered your video with Joe Rogan. And I was I have to try this. I got nothing to lose, So since then, carnivore, honestly, I haven't had single recurrence of any of the stuff that I mentioned.
That's awesome. I mean, I want to just kind of, IBS is an extremely common thing now. It's 20% of the population, I think, is somewhere in that neighborhood is diagnosed with it, or, has symptoms of that. And it's really kind of a catch-all diagnosis. Your gut doesn't feel good. We don't really know what it is, and we're just going to call it IBS. And, you went to a number. I'm interested about the vasculitis. How did you determine you had vasculitis? Because it's not something most people even are aware of. How did that manifest for you?
Well, I think I was 14, 15, it started occurring, on my legs. And then I, went throughout my life to different doctors trying to figure out what it was. I thought it was a rash or something. And then they just told me it's vasculitis. And then I saw another dermatologist, vasculitis. And, I asked, and it got to a point where it was getting more and more visible over the years, to a point that it was creeping up from my ankles all the way getting towards my knees. But, it was pretty obvious. And then, during summer, I didn't even want to wear any skirts or anything like that. So it was told to me that it just doesn't go away. It was just at some point they tried to give me some creams. Sometimes it would go away. To be honest, I don't remember what cream it was at this point because I'm not using it. But then it would pop up. It would pop up a lot, and then it kept getting increased in numbers too. It just wouldn't go away. So I haven't, I don't have it. And my doctor was surprised because he was what do you mean it went away? And I was well, check it out. It went away.
So I mean, you had visible, inflamed vessels that you could see, enlarged capillaries below the skin. And it kind of reminds me, we had a fellow the other day, he had psoriasis. It was like playing whack-a-mole. He would rub some cortisone cream on it. It would go away for a while and pop up somewhere else. And it was just you're constantly playing whack-a-mole with your skin. So that's interesting. And so at what point did you realize that doctors weren't able to help you? I mean, how long into this process do you feel I'm just not getting anywhere with these guys or gals?
It got to a point that I had the polycystic ovary syndrome too.
Okay. Yeah.
And my doctor was like, well, I'm just going to give you birth control. And I just didn't want to do that again. But I was like, is there anything else I can do? She said, exercise and, diet. And I was like, well, okay, I guess I could increase my exercise. But the problem with exercise was I had joint problems that were inflamed, that every time I would exercise, it would pop out of place. My hip, my like low back, and then my upper, like it was just consistently, then it would be a reason for me not to continue exercise. So I was like, I could try to increase that. And then the diet, I was like, okay, well, I can eat a little bit more cleaner, which means maybe less desserts. And we tried that. I tried that for like 3 months and it got bigger. My cyst got bigger, but then she gave me birth control and then she checked on it and it wasn't helping. And then at some point, when I started doing the diet, towards the end of the year of 2020, I went to get it checked, ultrasound, and the doctor was like, I don't see anything. What do you mean you have poly? It was a different doctor because I had gone to Michigan at the time because of COVID, work from home. And she said she didn't check. She checked with ultrasound. She didn't see anything. And she said, are you sure? And I was like, yeah. So she saw nothing. Like there was no signs of polycystic ovaries or anything like that. I think the reason I started is because my the candida recurrence was so often to a point that it was ridiculous. And then when the polycystic ovary syndrome happened too, in addition to all the other things that were constantly ongoing, I think I got a little bit fed up because of the doctors just trying to give me medication. And that was kind of the point where I was like, I was like 31 at the time too. And I don't believe that that's permanent because it is something human body, I believe, really is designed with, to me, the most efficient thing ever. If it's not working, it's not because it doesn't know how to work well. It does. It's just something I'm doing clearly is not helping my body. And I just wanted to find what it was. With whatever I was doing before, it was clearly not working. So I just decided to go with the carnivore. Again, I said, there's nothing to lose. I'm already kind of a hot mess. I tried all the other diets. This one I've never tried. And I momentarily tried keto, to be honest, before doing carnivore. I think you have to be a little bit too mindful about what you're eating. Otherwise, I gained weight on it. And I still was bloated too. So I had done that before carnivore and it didn't work out with me as much as carnivore